This episode of PHI includes discussion of child trafficking, exploitation, and abuse. While the conversation is meant to inform and empower, some parts may be emotionally challenging. Please listen in a way that honors your limits. Take breaks, pause, or step away if you need to. This topic matters, and your well-being matters too.
So I think it's really about helping bring data and stories for policymakers to help understand the impact that various laws will have. I'll tell you, this last year, we just successfully got a law passed in Connecticut. We've been working on this law for about 4 years to expand our affirmative defense. And this means that if a kid commits a crime, but as a result of their trafficking, if their trafficker tells them to go do something, or if their trafficker encourages them criminal activity, that kid can then go in front of a judge and say, I did this, but it was because my trafficker told me to or threatened me to.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
Hi everyone, today I am joined by Erin Williamson, who spent the last 2 decades working to keep kids safe from exploitation. Currently, she's the Chief Programs and Strategy Officer at LUF 146, where she leads national prevention efforts and survivor support programs. So historically, this field has been pretty reactive, right? They wait for exploitation to happen and then responding. What's the biggest institutional barrier that you've faced in shifting resources more towards prevention? And how do you overcome that crisis response mentality?
Yeah, that's still a really big barrier. I'm not going to lie. We still have, when you look at the resources that are being expended on kids who've already experienced trafficking versus preventing it from occurring in the first place, there is a real disparity in terms of the prevention world. And that's not to say that, we shouldn't be supporting kids who've experienced trafficking. Obviously we should, but, the best thing to do is, like you said, to prevent it from happening in the first place. One, I think there is a sense from a lot of people still that doesn't happen here. Mm-hmm. That doesn't happen in my community. That doesn't happen in my neighborhood. There's a huge misperception around what child trafficking is and what it looks like. And, the movies have not helped us and some of the TV shows have not helped us in reinforcing the false narrative that it's a stranger danger or that it's a kidnapping situation, when in reality, over 50% of the kids that are trafficked and referred to our survivor care services, they're still attending school regularly. Mm-hmm. Many of these kids are still living at home, right? Many of their parents have no idea when we show up at the door that something has happened to them. We have served kids in every single county in Connecticut who have been trafficked. And Connecticut is a fairly affluent state within the United States. Mm-hmm. This is happening in your community. But I think that there is this fear that if we talk about it, then it's going to happen. Or what we've also seen sometimes is we'll see it happening in a school system and we'll go to the principal or the superintendent and say, can we please come in and do prevention education? And they'll say, oh, we can't do that here because then we're going to be telling people that it's happening here. And so it's this prioritization of how things will appear or look over ensuring that kids have the information that they need to maintain safety. And again, I think that has more to do with how adults are going to react than the needs of our kids.
Yeah. A different prioritization that clearly 100%. Needs to be changed, of course. I think you're making good progress. And it's going to be slow. I think there's years of built-up barriers that need to be broken down. It just takes one brick at a time.
Yep. Yeah.
So kind of going into that idea of the systems and that learn and evolve as you're doing your work, you've been in rooms where million-dollar funding decisions get made, right? When you're advocating for survivor-informed programs, what's the moment when you see that light bulb go off for policymakers, and what's the most common pushback that you get?
Yeah, it's interesting. I think many policymakers First of all, I think this is an issue that does have bipartisan support. And I think many policymakers do want to know how they can help children. I do think because they're policymakers and they make policy, what makes the most sense to them initially is focusing on a more criminal justice approach, right? How do we get the bad guys? So helping them understand that getting the bad guys is not the same as supporting survivors, right? It's not the same as supporting the children who are vulnerable for trafficking. And really, in order to prevent trafficking, in order to support those who have been trafficked, takes a different type of policy and a different type of making sure that systems are functioning in a way that really does create kind of a safety net. And I'll give you one example of this. Now, after many, many, many years of advocacy, now when children go missing from care within the child welfare system, child welfare is mandated to report that to the National Center for Missing and Exploited Children.
Oh.
That didn't used to happen.
What did they do before?
Sometimes they would call police. Sometimes they wouldn't. Sometimes there was no standard way in which child welfare responded to children who were missing from care. But the research was able to show there was such a high correlation between children missing from child welfare, running away, and child trafficking that we were able then to say to policymakers and help them, like, there has to be some way for us to protect these children and stop that. And it's obviously we can try to stop kids running from care. But the other important thing is that when kids do go run from care, we have to have a standardized response. We have to have something that notifies kind of the people who have the resources to go look for that children to go look for those children. And the reality is that, law enforcement with support of NCMEC, and of course the support of other providers and child welfare are best poised to share information and go looking, proactively looking for that kid and not just wait for that kid to return if they return. So I think it's really about helping bring data and stories for policymakers to help understand the impact that various laws will have. I'll tell you, this last year, we just successfully got a law passed in Connecticut. We've been working on this law for about 4 years to expand our affirmative defense. And this means that if a kid commits a crime, but as a result of their trafficking, like if their trafficker tells them to go do something, or if their trafficker encourages them criminal activity, that kid can then go in front of a judge and say, I did this, but it was because my trafficker told me to or threatened me to. And affirmative defense is really important because, again, it's helping the courts recognize that child is a victim. They're not an offender. And we recently expanded affirmative defense to all misdemeanors. So any kind of, we were seeing a lot of kids, shoplifting, right? Their trafficker sends them into a store to get different outfits that they can wear during their exploitations, or has them hold their drugs because, they're a child and they feel like, well, they won't get caught. And so those were things that our kids were getting picked up on. And now they can go before a judge and say, that was because my trafficker was having me do that. And they won't be tried, or that's an allowable defense within the court.
That's amazing. Congratulations. That's a great
Thanks.
step. Years of advocacy, hundreds of meetings, and countless presentations to lawmakers. But now, when a 15-year-old gets arrested for shoplifting because their trafficker forced them to steal clothes for exploitation, they can walk into court and say, I did this, but not by choice. And the law requires judges to listen. That's what systems change looks like. Slow, methodical, and absolutely life-changing when it finally happens. You mentioned that Lev 146 uses that data to drive, program design and policy change, but not all data is generally created equally, right? So could you maybe walk me through how do you balance quantitative metrics with the qualitative survivor narratives when you're trying to prove that a program works? And we touched on this briefly in, episode 1, but maybe a little more detail on how do you show that your program does work to these policymakers?
Yeah, no, and that's a really good question. I would even expand that beyond even our programs to the whole anti-trafficking field. I think we talked about this in the last episode, but one of the things that happened early on in my career is I moved from an anti-trafficking organization over to an organization that was doing research and evaluation, and I did that because I was really questioning, how do we know that what we're doing in this field is having impact and is benefiting those we're trying to serve. And unfortunately, I will say 20 years later, we still don't have a lot of really good evaluation in the field, right? We have more research in the field, so people are doing more research, but they aren't evaluating the efficacy of programs in the way that I think we really need to be doing and should be doing. And so, at Love 146, we I would say have really pioneered a lot of that work within our own programs, in that we've worked with the University of New Hampshire's Crimes Against Children Research Center. In terms of our prevention education, they helped to develop the curriculum, like I said. They really pushed us to focus on skill building. They did an evaluation of our pilot of the program to show that it was having efficacy so that we could scale it. We recently published an evaluation that they did in the Houston Independent School District, looking at kids that went through the curriculum and comparing them to a sample of kids that didn't go through the curriculum. To our knowledge, that is the first ever evaluation that has compared kids who received some sort of intervention to kids who have not in the field.
Wow.
And so, we were able to publish that. And actually right now they're doing a randomized control trial in the state of Minnesota that will randomly assign sites to either receive the curriculum or not. The one in Houston was not a random assignment. It was comparing kids that were in gym class to kids that were in health class. I think it was a good comparison group, but they randomly assigned, which is kind of the highest level of evaluation. And so
Right.
What we've tried to do over the years is both evaluate ourselves and then also increase the rigor of that level of evaluation. And similarly, I mentioned in our survivor care program, we handed over about 5 years of our data for them to do an analysis of. And then now they're also enrolling kids in a more of a longitudinal evaluation where they'll follow those children for one, at least a year. I think it's really important that we do evaluation.
Yeah.
And I know that people are scared of evaluation, right? People think about evaluation and they think, well, what if they don't find anything that will close our program? And I think that to do right by the people that we're serving, we need to change our mentality.
Mm-hmm.
And we need to stop thinking of evaluation as this like on or off switch. It's all good or all bad. And really work with evaluators that want to come alongside us and support us, not just in figuring out, are we having impact, but how could we have more impact, right? Mm-hmm. How could we improve our services? What could we do better? After each of the evaluations that we've done with our prevention education program, we've sat down with their findings and with our evaluators and thought, okay, we thought we were talking about this, but actually, when we go back to our curriculum, we realize we weren't being as explicit about this as we thought. One perfect example is the internet, right? In the Houston Independent School District asked a couple of questions that, initially we thought, yeah, that totally makes sense. And then when we got the results that we weren't as effective in that area, we went back and we looked at our curriculum. We said, how do we actually talk about some of these things? Are we explicitly talking about them? And we shifted a lot of our latest version of the curriculum based on our research findings of what was working well. We either kept it and enhanced it, and what wasn't working well, we looked at those modules and we said, how do we reframe these? How do we shift these to either have impact or put something else in there if these aren't having impact? And so I think that when we think about evaluation, we need to think of it as an iterative process that we're doing alongside our programs that are helping us to improve. Mm-hmm. That said, I will also say that it is hard to work with evaluators, right? As a former evaluator and as someone who's working with evaluators, you have to be confident and you have to have a trusting relationship with your evaluators, because they're going to come to you with ideas, or they're going to come to you with write-ups that you're going to say, no, 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 no.
When Love 146 partnered with DeKalb County School District to implement their naughty number curriculum in 18 schools, they weren't just teaching kids about trafficking. They were proving that prevention education could be scaled through existing systems. But scaling good programs requires changing entire systems, which means walking into rooms full of lawmakers and budget directors and making the case that everything that they think they know about trafficking prevention might be wrong.
And I'll just give you an example. When our evaluators first started talking with us about evaluating our survivor care program, they said, well, we'll just give all these kids like a disposable phone, and we'll send them a text message once a month that they can use that phone to take the survey. And I just paused and I said, so you're going to give kids, many of whom, if they live in a congregate care facility, are not supposed to have phones, a burner phone. You're going to, one, expect them to hold on to that for a whole year. And two, that that's something we tell parents and caregivers to look for. Phones that are unexplained as a potential red flag, to ask more questions to see how they got that phone and who gave it to them, right? And we were like, first of all, there's no way those kids are holding on to that phone for a year. They don't even hold on to their own phones for a year. We're switching numbers with them all the time.
Yeah.
And two, so you have to be able to see it as a relationship, right? And as a partnership. And sure, there are some times where they need to have their independence and they need to be able to go off and do their work independently of you. But you also need to make sure you find an evaluator that respects what you're bringing to the table too, and doesn't just see you as a source for data.
Yeah.
Right. That they can then mind, right?
Yeah.
They see you as a partner in figuring out, how does this program work best? How can we improve this program? And is really there to support you in finding out what is and what's not working within your programs.
Absolutely. I think those are great tips. Cracks me up about the phone thing. That's actually, but that's what a partnership is. You keep each other. You give reality checks, like this won't work, and they'll give you reality checks back. So just to kind of wrap up our conversation here, you're working towards a future where trafficking prevention is integrated into schools, healthcare, and community systems. Can you paint me a picture of what it would look like if a teenager in crisis in 2035, for example, encountered a system that was actually designed to prevent exploitation rather than to just respond to it? What would be your dream?
I kind of look at it the same way we have evolved with intimate partner violence, right? It used to be that people thought your husband couldn't rape you, right? That couldn't happen. It used to be that some people understood what that meant. Some people didn't understand what that meant. Now, you walk into almost any, OBGYN, any, bathroom stall and different things, you constantly are seeing notes of, if you need help, you can come here. You see people are talking about it more. People are becoming elected to government positions saying, I have experienced intimate partner violence. That is part of my narrative. That is part of my story. And they're saying it without shame, right? They're saying it from a position of, and I'm not saying that it's not hard. I'm sure it is very difficult to say that publicly, but there was a time at which people would not talk about that publicly, which people would not believe that was actually happening to people in their community. And now I think at every different socioeconomics level, at every different race, at every different kind of relationship, whether it be, LGBTQ or straight or, people realize that violence is happening in relationships, right? This isn't something that's impacting everyone. And my hope would be that we get to a point where trafficking recognized in a similar way, right? I oftentimes say to kids, if you went on a first date with someone and they hit you, you wouldn't go on a second date with them, right? That's obvious, right? And that's because traffickers, that's like not how intimate partner violence works, right? It's usually amazing at the beginning, and then it's something that slowly happens over time, and then it's this cyclical thing. And we're seeing that trafficking is very similar, right? And yet we're still not quite at a place where we're not blaming victims, or we're not trying to find what did they do wrong. And I think that our mentality has to switch, similar to how it did for IPV. And I'm not saying everything's great for IPV. I know that there's still a lot of stereotypes, but we've overcome so much that, you know, when an individual doesn't want to press charges, or does want to press charges, or decides to stay with their partner and go to therapy, or doesn't stay with their partner and decides to leave, like all of those decisions are understood within the complex nature of intimate partner violence. And I hope that at some point we get there.
Yeah. Would that be through that, you know, as you mentioned, like talking about it more, framing it as a prevention type of, but is there a specific way that you think the system, or generally like society, can, how do you imagine that kind of happening?
Yeah, I mean, I definitely think that no child should graduate high school without knowing the term human trafficking, which is still happening today, right? Yes. Lots of kids are graduating and have never heard the term human trafficking. Even those kids who've experienced trafficking have never heard the term human trafficking. In my mind, ideally, no child should graduate middle school, honestly, without hearing the term human trafficking, because it's happening at a much younger age than I think we think it's happening. And I mean, if it's familial trafficking, it's even happening at a younger age oftentimes. So I do think we need to integrate it into, you know, school education programs, and we need to integrate it into, you know, there's a lot of legislation that talks about, you know, talking about sexual violence in school, and that's great legislation, but it doesn't always include human trafficking. And oftentimes it includes, you know, one-time sexual assault and intimate partner violence. And there's such a spectrum that even bleeds into human trafficking. And I think human trafficking should be included in that as mandatory for all sexual. I think a sexual violence program that does not talk about human trafficking is not a robust sexual violence program.
Yeah, no, I'd agree with. After hearing everything you've kind of told us over the span of the last few episodes, I'd agree completely. I think an uninformed child is one that's vulnerable, right? Or
Absolutely.
Is going to be taken advantage of in that way. So I think there's that idea that, as you mentioned, some of the barriers is that, you know, we don't want them to know it happens, or that stigma around talking about these type of things. Well, it only really happens in like true crime podcasts. You know, it couldn't happen to me here. Being informed is the best way to keep them safe, for sure. Well, absolutely. I think that's kind of the end of that. Thank you so much for talking to us about Love 146, your work, and just generally about anti-trafficking, the movement, the work, the prevention that needs to go into really ensuring that our work is survivor-informed and helping those that are most vulnerable. Any last-minute words that you have to share with our audience?
No, the other thing I would just say, remind our audience is, you know, there is a high chance that somebody who's listening today has experienced their own violence or victimization. And I think that, you know, for those of us who have had that sort of experience, it comes up, you know, things can come up for us throughout the rest of our lives. And just please know that, you know, self-care is really important. Going and seeking help and support, and then just, you know, self-care in terms of taking walks or being in nature and things like that. So if anything that we mentioned today or on any of the other podcasts, you know, has hit you in a unique way, either because of personal experience or experiences of someone you know or someone you worked with, you know, take a moment today to care for yourself.
Mm-hmm. Absolutely. Thanks so much, Erin.
Thank you.
If there's one thing to take away from my conversation with Erin, it's this. Prevention doesn't happen in courtrooms after someone's already been hurt. It happens in classrooms, in clinics, in communities. long before anyone becomes a statistic. As Erin reminds us, when we shift our lens from punishment to protection, we don't just fight trafficking. We build a world where fewer people are at risk in the first place.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.